Hello. Hello and good evening. It is wonderful to have to compete with your fantastic in-person conversation. So good to see everyone here tonight. Good evening and welcome to the Brookline Center's 2023 Women at the Center Kickoff. It is just wonderful to be able to be your MC this evening. Thank you to those joining us here at the Harvard Club of Boston and friends of the Brookline Center who are live streaming across the country. After 2 years of Women at the Center Kickoff MC duties via Zoom, I don't know about you, but it, for me, really does feel great to be in person together. Throughout tonight's program, we will deepen our understanding of women's and girls' mental health. We'll hear stories of resilience and healing, and we'll learn how the Brookline Center is aiming to expand its impact on the mental health care system. And it just occurred to me, I don't think I said who I am. So my name is Tiziana Deering. I'm the host of Radio Boston on WBUR, and I'll be your MC for the evening. Thank you. However, I know what you're really excited to do, which is to join me in welcoming the big event, our esteemed guest, Dr. Rochelle Walensky, Director of the Centers for Disease Control. And you can look forward to a robust conversation with Dr. Walensky later in the program. We'll speak about leading in the public eye, about navigating challenges, moving forward, and Dr. Walensky will provide us some insights on the future of public health and COVID, nationally and globally. But now, as you surely know from the headlines and from our own lives, women and girls' mental health are an enormous public health challenge today. According to a recent CDC report, American teenage girls are experiencing alarming levels of hopelessness and suicidal thoughts. Nearly 3 in 5 teen girls say they feel persistently sad or hopeless, and 30% say that they have seriously considered dying by suicide in the past year, a percentage that has risen by nearly 60% over the past decade. The CDC's chief medical officer, Dr. Deborah Oury, recently said, quote, "As a parent to a teenage girl, I'm heartbroken. As a public health leader, I am driven to act," unquote. As a journalist and a parent of 2 young adults myself, I could not agree more. But it is not just our teens. According to the American Psychological Association, 62% of women aged 18 to 34 report being overwhelmed by stress most days. Most days. A 2022 study by the Kaiser Family Foundation found that 38 to almost 50% of women under age 50 report symptoms of anxiety and depression, and 50% of all women who needed mental health support last year could not access it. Your participation here tonight is a testament to your shared commitment to listen and to learn and to act. And now, without further ado, please join me in welcoming Dana Lazowski, Chair of Women at the Center.
Thanks, Tiziana. Good evening. Last time I stood at a kickoff podium was on February 13th of 2020. Earlier that day, the CDC confirmed the 15th coronavirus case in the United States. None of us gathered at that kickoff had any idea that COVID was about to explode, setting off a global lockdown and 3 years of fear, anxiety, uncertainty, illness, and the loss of more than 1 million lives. How fitting that at our 2023 kickoff, when we are finally able to be back together in one space, we are joined by Dr. Rochelle Walensky, who has played such a critical leadership role in addressing this pandemic, first at MGH and then at the helm of the CDC. Whether we were in person or virtual, the Women at the Center Kickoff has always been an opportunity for women and other members of our community to connect through a shared commitment to mental health, to connect in our understanding that we are all affected by mental health challenges, both directly and indirectly. And most importantly, to connect over the simple truth that our impact is greatest when we join together with purpose. Our very first Women at the Center Kickoff was held in January of 2013. Happy 10th anniversary. Over the past 10 years, with your help, we have raised over $1 million for women and girls' mental health. Yes. And by the end of this evening, with your help, we hope to bring that total to $1.25 million. As chair of the Women at the Center, I have the privilege of working alongside an incredible group of women. Their names are marked in your program, and I want to thank each of them for their leadership and commitment to our work. I especially would like to thank our past two chairs, Michelle Fischel and Jackie Francona, whose vision, whose vision and wisdom have been instrumental in guiding our work and purpose. I would also like to thank Nancy Weinberg and Allie Reed from the Brookline Center. Lastly, I would like to thank all of our sponsors whose generosity had made tonight's event possible and who brought together more than 500 people for tonight's event. The outstanding care provided at the center has been an anchor in our community during these turbulent years, and we could not have done it without our family of supporters. Thank you again for joining us here tonight in Boston and online, and I hope tonight will leave you eager to expand your connection to the Brookline Center and be a part of its exciting future.
Dana, thank you. So the convergence of extraordinary demand for care and historic workforce shortages means less access for everyone. Community mental health providers like the Brookline Center, created to serve the entire community and ensure access to those most in need, are particularly impacted by this scarcity of clinicians because they have to compete with better funded universities, schools, hospitals, and private practices. So if the status quo isn't working, and it isn't, what is the new way forward? Here to share more, Ian Lang, CEO of the Brookline Center.
Thank you so much, Tiziana. As always, I am inspired by the strong show of support at this wonderful event. Dr. Walensky, we are thankful for your leadership at the CDC and honored to welcome you here this evening. I would also like to warmly welcome State Representative Tommy Vitolo, Brookline Select Board Member John Van Scoyac, and Sharon Shapiro of the Ruderman Family Foundation, one of the center's key philanthropic partners. At the Brookline Center, we work on the front lines of a crisis that was brewing long before COVID. Every day, we see the toll these years are taking on all of us, particularly on the most vulnerable. But we are also witness extraordinary flexibility and creativity in the face of these challenges. Brookline Center staff and clinicians have shown enormous dedication and skill, and we've been blessed with strong support for our work. All of this gives us confidence that with your partnership, the Brookline Center will continue to meet the mental health needs of our community with compassion and innovation at the fore. As Tiziana noted, there is a dire shortage of mental health providers in the U.S. today. By one estimate, the number of clinicians is sufficient to cover just 13% of the actual need. For years, public health officials have advocated for greater attention and resources for mental health. But endless wait lists remain the norm, and individuals and families are routinely referred to providers not accepting new patients. The way we approach mental health is fundamentally flawed. Historic disparities and inequities, well documented in our healthcare system, are multiplied in mental health care. We routinely underestimate need, provide a limited toolbox of treatments, and fail to account for the economic truth that growing our current approach is unsustainable. The parallel challenge of a workforce shortage and historically high need for care demands innovative solutions to expand clinical capacity and increase access. We are facing a seismic shift in the mental health of an entire generation. And to turn the tide, we must change how, where, and by whom mental health care is delivered. In response to today's mental health landscape, the Brookline Center is reimagining our core work. Earlier this year, we began an evolution from outpatient-centered community provider to an expanded role as a center for developing and delivering groundbreaking cross-sector mental health programs and services. At the heart of this effort will be the launch of the Brookline Center's Innovation Institute, with a mission to transform the mental health system so that it is accessible and equitable for all. We will do this by designing new solutions in partnership with our community, by testing these new approaches to make sure they deliver real improvements for the clients we serve, and then by sharing them with other providers and communities so that the entire system can benefit. Why the Brookline Center? Because meaningful innovation and outstanding care are intertwined in our DNA. More than 60 years ago, Brookline community activist Edna Stein had a vision that mental health care could be delivered in the community where we live. By bringing care out of institutions and into our neighborhoods, Edna not only changed the way services were delivered, she also changed people's lives. It is this legacy of transformation that we are honored to build on today as we seek to help design and create a new system that can meet the challenges we face now and in the future. On behalf of all of us at the Brookline Center, I invite you to join us in this vital work, and I thank you for your support tonight. Thank you so much.
Ian, I appreciate that powerful update on the center. I'm sure that we all do. And now the next portion of our program, in so many ways, truly the most important. Christina Yee has been a Brookline Center board member since 2007. Over the years, she's held a whole bunch of different roles. Gala chair twice, auction chair, governance and nominating committee chair, chair of the Strategic Development Committee, and vice president. But toward the end of 2021, Christina took on a role at the Brookline Center that she had not imagined filling as a client. And this next part is important. One of the most intimate things that we can share with someone else is our story. Christina is going to share her story with you tonight in a closed, supportive community. There may be details in it that other people dear to her in her life don't know. So I ask you to appreciate the gift of her story and keep it here in this close and supportive room. And now, we welcome Christina Yee.
Friday, August 13th, 2021 was like any other summer morning. My husband Josh and I were grocery shopping to host a dinner for friends that evening. We had a silly argument, and before I knew what was happening, he screamed that he was going to kill himself and ran out of the store. Stunned, I chased after him and tried to stop him from leaving. I called 911, and this began a manhunt for Josh by several police departments. With GPS on his phone disabled, Josh could not be found until much later when his location came back online and simultaneously his suicide note hit my inbox. When police found him, my husband was prepared to jump from the top of a multi-story building. Our family appeared to have a picture-perfect life. 2 lawyers, 2 adorable sons, all the friends, a lovely home in a desirous zip code, travel and good times. Outwardly, as our social media and posts and holiday cards depicted, we had it all. This is probably not what you envision when you think of mental illness. Josh describes himself as a chameleon, able to fit in anywhere. He's loving, kind, and affable, a great dad, a mensch. Everybody loves Josh. Kids flock to him, and adults seek his insight. Indeed, Josh so skillfully concealed his mental illness that even I, his partner of 25 years, had no idea that he suffered from major depressive disorder, no understanding of the internal pain he endured, no awareness that he numbed his pain by engaging in self-destructive behaviors, no knowledge that he had spent the last year planning his suicide and that his first attempt was when he was 17. He felt empty, worthless, and sought external affirmation throughout our entire marriage. My husband was leading a double life, and I had no clue. The son of a chemistry professor and an MD, PhD, Josh and I met our first day of college. By contrast, I was the daughter of high school graduates, but my parents, raised by small business owners, were equally hardworking. They divorced when I was 4, remarried, my mother twice, and each had 3 more children. Growing up, I was always loved and provided for, including a private high school education, but not without sacrifice, as later I noticed collection and foreclosure notices that my mother always resolved just in time. At the beginning of my sophomore year of college, I had to drop out of school and move home because, despite their best intentions, my parents could not pay my tuition. From that day forward, I took control of my life. I took out loans, waited tables, and paid for my car, food, housing, and tuition. I began to build my identity around being very, very capable. Shortly after returning to college, my beloved mother suddenly fell ill and passed away 6 days before my 20th birthday. She left me, my 11-year-old twin brothers, and my 2-year-old sister. She was 42. After putting myself through law school, I married Josh and we moved to Brookline. I was happy, but faced many challenges. Family legal troubles, my brother's opioid addiction, and a sister with severe mental illness of her own. And for several years, we even had family living with us. To manage it all, I doubled down on self-reliance. I was a fortress, my walls keeping my pain and my needs securely tucked away. To the world, I stoically presented the person everyone believed me to be: confident, fearless, selfless, competent, strong. But everyone has a breaking point, and I found mine that August day. After his breakdown, Josh was hospitalized for a month and then completed a 6-week partial hospitalization program. That first month, I traveled 3 hours every day to see him, all while running my law practice, unraveling the mysteries of his deception, and caring for my boys, who couldn't know all the details, but were scared and confused nonetheless. I tried so hard to maintain our privacy and to keep it together. But my life was in turmoil, and tasks as simple as walking the dog brought me to tears. I was overwhelmed trying to navigate an impossible mental health care system. After years of being self-reliant, I did not know how to ask for help, even from my loving and supportive extended family and friends. During all the years of my board service to this wonderful organization, I never expected to be a client. I've spent a decade sitting where you sit tonight, listening to similar stories. But when I realized, finally, that I needed support, I turned to the center and discovered firsthand the healing power of community mental health. Over time, everybody in my family received support at the center, and we survived because of the center's incredible wrap-around support. I wish I had a storybook ending to report, but despite almost 2 years of suppressing my own feelings to prioritize the stability of my family and care for my husband, the impact of Josh's self-destructive behaviors and betrayals was too great. Ultimately, our marriage could not recover. So this is us now, a beautiful, broken family that is healing. Josh is stable, continues to see his center clinicians, and most importantly of all, is grateful and happy to be alive. Our separation saddens our boys, but they are resilient and strong, and so am I. I am finding my own way forward, a mom learning to be okay with imperfection, a woman becoming more comfortable every day relying on others, no longer a fortress. Mental health crises do not discriminate. That family who seems to be leading a picture-perfect life may be struggling in ways that you cannot see. Mental illness can affect anybody, no matter your background, your socioeconomic status, or your Instagram feed. I am forever grateful that the Brookline Center was here for me, and I hope with all my heart that with your support, it will continue to be here for many others. Thank you. Thank you. Thank you.
Christina, as fellow board members, and I think even more significantly, dear friends, and on behalf of everyone who's in this room tonight, and those of you who are streaming at home, thank you for sharing your journey with us tonight. Come stay here with a couple more minutes. Your story is about the mental wellness of women, what shapes us, what breaks us, and most significantly, what helps us to heal. But more than that, it's a testament to your resilience, your tenacity, and your remarkable strength. The three of us, have talked together well before this event about how difficult it is to share your story out loud, that it takes great courage, great commitment. But we also know how empowering it is to speak one's truth out loud. And in this instance, this is your truth, Christina. What a gift you've given to each of us here tonight to be able to hear your story and to be healed simply by the telling of it. You're an absolute inspiration, and thank you. And now we're going to let her sit down and enjoy the rest of the evening. Georgia.
Friends of the center, thank you for being here tonight. Christina's story illustrates how complex and how all-encompassing mental health challenges can be, and the power of community mental health to support healing. It shows that mental health crisis can happen to any of us, our families, our children, our partners, regardless of how successful or put together we may appear to others. And it demonstrates how imperative it is that community mental health services are available to everyone who needs them. Every year, over $1 million of care at the Brookline Center is subsidized by philanthropy from individuals. A quarter of that funding will be raised through tonight's kickoff, and Karen and I are here to help make that happen.
The Brookline Center established the Edna Stein Society, mentioned by Ian earlier in the evening, to honor our founder, who knew that communities are stronger and healthier with access to mental health care. Members of the Edna Stein Society sustain her vision and provide us with the critical funds to expand on it going forward. So when we say, "I'm with Edna," we demonstrate our commitment to the mental health of our surrounding communities. Tonight, we're asking for your help. Let's all be with Edna tonight. Let's all be with Christina tonight. Let's carry Edna's vision forward so that every woman and each girl who turns to the Brookline Center for help can tell a story of both rebuilding and the significant story of recovery.
We invite you to join us tonight as a member of the Edna Stein Society with a gift or pledge of $1,000 or more, or by signing up for a monthly contribution of $100. If you became an Edna member at a previous year's kickoff, thank you. And tonight's the perfect time for you to renew. If you're here or tuning in as a guest of a sponsor or friend, this is also your opportunity to honor your host and pay it forward. So here are your instructions. If you're an in-person attendee, you can make a gift or pledge right now by completing the card at your place setting, slipping it into an envelope, and leaving it in the box on your table. And those envelopes are inside your program. At-home participants can donate by clicking the donate button on your screen. You may have to scroll up and down a little bit. You can also click on the pledge button and submit a pledge to be fulfilled later. The fundraising goal for tonight's kickoff is $250,000, and every gift or pledge, no matter the size, is appreciated and will help us reach our goal and expand women and girls' mental health services. I'll pause now to give you a minute to complete your gift or pledge. Just a little pressure. No pressure.
Christina was fantastic.
She was amazing.
Absolutely
Amazing. Amazing.
I was a little anxious because we never had a chance to.
I mean, I couldn't believe that she could stand up the entire time. Amazing. Here, I think you can do it. Should we do
How
this?
long should we wait?
I think we can.
Looking at Nancy for a high sign. I think we can probably go ahead.
I think we can.
Okay. Hopefully those of you at home have been able to scroll down and click on whatever links you need to click onto. Thank you all for your generosity. Thank you for coming here, for being here tonight. And thank you for becoming a part of the Women at the Center family. Those faces that we've seen before, and some new faces tonight that hopefully we'll see again. Thank you all very much, and please enjoy the rest of the program.
Thank you.
Good evening. At the risk of interrupting someone writing their full credit card information, don't forget the CCV code. First off, thank you very much, Karen and Georgia, for your remarks. Thank you, Christina, for your very important story that you shared with us. Thank you to all of you here and to everyone at home for your participation, for your generosity, and for your commitment. Before I get to my formal prepared remarks, first off, there are here in the room tonight a number of individuals who are part of the staff, the very hardworking staff of the Brookline Center. You know who you are. Would you please stand so we can give you thanks? That's just 5 or 6 of the 110 to 112 strong that work at the Brookline Center each and every day. Looking around the room, I also see many of my fellow members of the board and also members of the Strategic Development Committee. I'd ask that all of you stand so we can thank you for all your hard work for the center. Between my wife, Margaret, who's here with me tonight, between the two of us, we've attended all but 2 of the past 10 Women at the Center kickoffs. I used to say I was one of the few men at the center at these events, but looking out at this crowd tonight, I can see that the secret's out. And I'm very grateful to all of you who are here tonight, men and women. As the president of the Brookline Center Board, it is a distinct privilege and an honor to welcome Dr. Rochelle Walensky to our 2023 kickoff. Apparently, many of you have very personal ties to Dr. Walensky since this event was first announced, and she was announced as our guest of honor. It's been a little bit of 6 degrees of Rochelle Walensky. We've got people here tonight with preschool connections, Brookline connections, synagogue connections, camp connections, Harvard Medical School, Mass General Hospital. Dr. Walensky's community building talents are as impressive as her professional accomplishments and achievements. Dr. Walensky is the director, as you've heard, of the Center for Disease Control and Prevention and the administrator of the Agency for Toxic Substances and Disease Registry. I'm not sure how you fit that all onto one card, but there you go. She's an influential scholar whose pioneering research has helped advance the national and global response to HIV/AIDS. She's worked to identify, treat, and combat deadly viruses throughout her career. Prior to being at the CDC, she served as chief of the Division of Infectious Diseases at Mass General Hospital and a professor of medicine at Harvard Medical School. She's been on the front line of the COVID-19 pandemic, advising both Boston and Massachusetts leaders on COVID response and policy. And she's researched vaccine delivery and strategies to reach underserved communities throughout the Commonwealth and elsewhere. She's the past chair of the Office of AIDS Research Advisory Council at the NIH and has served as an advisor to the World Health Organization and the Joint United Nations Program on HIV/AIDS. Dr. Walensky, thank you so much for being with us tonight. While Dr. Walensky is coming to the stage, our fabulous MC, Tiziana Deering. Thank you, Tiziana, for being here with us tonight.
My iPad.
Okay. Tiziana is going to be leading a conversation with Dr. Walensky, followed by a Q&A with questions that have been submitted in advance by attendees. As I think most of you know, if you have a radio in your homes, you know that Tiziana is the host of Radio Boston on WBUR. She's been a commentator and a contributor to WBUR for over a decade. So thank you again. And take it away.
So I looked up today the last time you and I talked. And it was March 10th, 2020. Which is the day that Governor Baker declared the state of emergency. We had just started doing on Radio Boston this opportunity for people to call in and ask a doctor questions. You were one of the very first doctors who ever came on. And I went back and listened to some of that today, and you were explaining the CDC's latest guidance on hand washing. This is true. And you were talking about the fact that there were playlists that are available for the right length of time. And you were talking about how many surfaces we did or didn't know we needed to disinfect. So it was a fascinating thing because you were really tooled for a moment like this in your career. Where then did you think you might be now? Because I know it wasn't in this chair as the director of the CDC.
First, can I just say, first of all, it's just such an honor to be here. And let me just say thank you to Christina for sharing your bravery and strength with all of us and for demonstrating what's possible with places in community like the Brookline Center. So I just want to say March 10th, 2020, I kind of knew we were at an inflection point, that something was going to be different, and we were in a moment that was going to be different. If you said, December 2019, I might have said 3 years from now, 4 years from now, I'm going to be chief of infectious diseases at Massachusetts General Hospital. I had work to do. I envisioned taking on that role for some period of time. I was only 3 years in. March 10th, 2020, there was just a lot of uncertainty and a lot of fear of what was ahead.
When did you get the call for the CDC? How did you find out that you might be the next director?
So I want to just clarify, I did not apply for this job. So we were pretty well in the thick of it. In fact, I was on clinical service, and I remember I was actually gowned and gloved on clinical service when my son called and said that Biden had been announced the winner. My phone just kept going off. I was like, I'm in a room. I can't answer the phone. But I remember him calling. I don't remember the exact date, but I was at Mass General in my office. It was November, and I remember I had been up to my chairman's office. I had a meeting with her, and I got back, and there was a message that Ron Klain called with a 202 area code. And I was like, I know that name. And then I Googled the name again. I was like, the Ron Klain? So I did not call him back immediately. A few of you know this story. I called my husband. And my husband, who knows me well, said, whatever he says, don't say no. Just say you'll think about it, whatever it is. So he asked me if I would consider thinking of, I actually thought it might be a job in Washington, but he asked if I would consider the position as CDC director. And so I said, I'll think about it. And then sort of the process of vetting started and interviews.
So that's what I really want to know, because, did you actually think about it, or was there a couple of possibilities, right? You got the call, you didn't say no, you already knew in your stomach what you wanted, but you thought about it. Or, boy, I don't know if I want to do this, I really need to think about this.
Or, I don't know if I can do this.
Well, isn't that interesting?
Right, I mean, am I up to this task? We were in the middle of a pandemic, deep in the middle of a pandemic. And the CDC, by the way, is in Atlanta, Georgia, and my family is here. So, and oh, by the way, the CDC was really under fire. It was not thriving. And so what was being asked of me, and I sought counsel from a lot of people, was to sort of pick up my life, which would change dramatically, and take on something that was well bigger than I was actually, I was already had my hands pretty full, was well bigger than I had at the time. So there was a lot of, is this something I can even do?
Has there been a moment where you realized, yeah, I can do this?
Well, I am. So there have been plenty of days where I say, you have got to be kidding, or uncle, or Mpox, or Ebola, or, so there have been plenty of those days. But every day you get up and do it again. I have, and when I give sort of like advice to junior faculty or, young mentees or older mentees, there is a component, and this was wise counsel that was actually said to me, I think by somebody in this room, which was, if it doesn't feel too big, you're not chewing off enough. You haven't reached high enough for whatever it is that you do. This felt really big. Don't get me wrong, but that was wisdom I got once upon a time.
You did take over a troubled and embattled organization, and in this sort of delicate balance, I would say, as an observer of a troubled and embattled organization at a time when we as a collective desperately needed it to be neither troubled nor embattled. What were the biggest pain points when you got there? And what has the work been, and how far do you think you've gotten?
So we had the huge task of trying to get out of this pandemic. And that has been, every time for so long where we thought we were out of it, then the Alpha wave, then the Delta wave, then the Omicron wave, and just as we were starting to be able to tolerate some of these Omicron subvariants, Mpox, and it really has been one thing, or a new case of paralytic polio in this country. It's really been a lot. And at the same time, the CDC and the people of the CDC, 12,500 of them, whose work you will never see because they are never asking credit for it, whose business cards say 24/7, and when I tell you it says 24/7, I mean it. Like EIS officers rappelling out of helicopters to drop test kits onto cruise ships. Really heroic stuff. They were hurting, and they didn't know that whoever was going to come in they could trust, because they couldn't trust prior leadership. And so making sure that we could both get out of the pandemic and that they could trust that I was going to have their back when I was somebody they didn't know was a lot of work. I think we've made a lot of progress there.
As a leader, what was a really important way to show that you had their back?
Navigating and working with them to just listen, to recognize that, when tough decisions had to be made, I was going to seek their counsel, I was going to lend their voice, I was going to project their voice forward, I was going to let them know what was important, let them have their important voice be heard. I was going to make hard decisions that sometimes weren't popular. And I think, one of my biggest challenges early on was there were many, many leaks to the press early on in the prior administration and early in this administration. And I think those have largely gone.
Is there a particular day or a particular moment over these last couple of years that just really stands out to you?
You don't have enough time.
I have a little time for one.
I can tell you where I was when I got the first call of the first Mpox case. I can tell you what hotel room I was when, we heard about Omicron. I was taking the turkey out of the oven when I got the White House call about Omicron from South Africa. And I know there are so many other colleagues of mine who are here, who are in healthcare, and can similarly say the last 3 years, all of what we have done has been marked by really difficult times. When I'm in a different time zone and I'm in middle of the night on phone calls, or not in a different time zone, middle of the night on phone calls, to how are we going to tackle this issue or that issue or a policy issue or a travel issue. There have just, or again, this paralytic polio case in New York on July 17th, there have been so many of them. It's been a hard 3 years.
So 2 questions from that. One, that's the second time you sort of listed just an onslaught, right? And I wonder, of course we can't set COVID aside or take COVID out of it, but should one be able to, if one could, is that a lot? Like if you picked a whole bunch of sample chunks of 2 years in time in the history of the CDC, with COVID set aside, all these other things, is it more than usual? Is it a lot?
So I don't get to walk in the shoes of prior CDC directors, and I will say, I think that nobody really understands the internal pressures until, even those who've served in it, until you're doing it. So I don't know. There have been H1N1, prior Ebola outbreaks. There's been a lot in prior administrations. It feels like it's been a lot. I will also say, I just listed infectious disease threats. I'm an infectious disease clinician. And there has been opioids, and there has been mental health, and there has been firearms. So and there's just a huge amount of chronic illness that is out there that intersects so vividly with what happens in infectious disease threats. So it is not just that, but it is all the underlying as well, and a really deeply frail public health infrastructure in this country.
So there's a lot there that I want to get to, and in a minute we will shift sort of our aperture away from COVID in those first few years. I want to stay there just a minute longer. And you got to a piece of what my second question was in your answer to that one. And of course you are a strong leader. You will present a strong front. You are resilient and vital. But what you have just talked about is not normal, and it's hard. And there's no leader in the world that wouldn't be carrying that. How are you?
I'm okay. Thank you for asking. I'm okay. There is no question that this has been a hard 2 years and 2 months. Yeah. And yes, I know about how long I've been there. And in fact, I would say 3 years, because while I've been serving in this role for 2 years and 2 months, that first year before it, though less public, maybe public enough in the Massachusetts arena, those, and I know my colleagues who've been with me at, side by side in healthcare, we looked at documents called crisis standards of care. We talked about what do we do when we run out of ventilators. We entered a hospital that had a refrigerator truck outside. Those also are not normal. And not anything we ever thought. We saw our colleagues get sick from delivering care. So there's sort of 2 chapters to this. I'm okay, and maybe I'll just say I'm partially okay. I don't have a lot of time for friends. I don't have a lot of time for chat. But as I look around the room, every once in a while, I'll get a ping or a heart from so many people around the room that just reminds me I've got community, and I have friends, and those, like, I'm really even bad about responding because I'm like on 6 calls.
You're the director of the CDC.
I know, but I like to respond. But so I do want to say thank you to everybody here. That's why I'm okay. That's why I'm okay.
So are the kids all right? Are our kids okay?
I think our kids in the country are, you read some of the statistics early on. I think we have a serious mental health crisis in this country. I will say I am feeling very blessed in this moment. My kids are okay. We lost 1.1 million people in this pandemic. My immediate family is okay. I'm going to do a shout out to my mom, who I think is listening.
I'm knocking on some wood for everyone.
Thank you. But I in all of this, there has been an extraordinary amount of tragedy that so many people have personally felt, and part of the reason that I'm okay is for the most part, my personal family has done okay, thank God.
So we know there are a lot of families where that's not been the case, and we know about, the 60% of adolescent girls who report persistent sadness, the nearly 30% who have made a plan at some point or considered making a plan to die by suicide. There are a number of other numbers. The executive summary of the report from February by the CDC, I think, is kind of required reading in our need to understand where we are in mental health. So I'm married to a mental health professional. I remember some conversation before COVID of a sense that we were seeing the tip of a shark in the water, right? And so part of what I have wondered is, now I can't carry that metaphor because the shark doesn't grow in the water. Okay, pretend we didn't do the shark thing. Was it there and exacerbated by so many of the dynamics of COVID over the last 3 years? Were we headed to a mental health crisis anyway? Or is there something new that was birthed during this pandemic? Do we know? And maybe it doesn't matter. Maybe the answer is, who cares? We have this problem and now we need to do X.
And I think both can be true, right? I think we were on a steady incline. We were having true challenges. I think many people involved in the Brookline Center could have told you that ahead of time. I do think that the pandemic certainly didn't help things. Children who were home didn't have community. There are some children who thrived being home. There are some children who did fine being home. But the community school, the shakeup of our lives, the food insecurity and economic insecurity and all the things, and partner violence and all the things that happened during this pandemic, it certainly didn't help.
So then we layer on, and you brought it up, firearms. One of the things that's really striking is the fact that we've reached a point now where more children die from firearms than any other cause. And that was not the case and is now. And that we've seen an increase, and in fact, I pulled these numbers to bring, and I want to get them exactly right. In 2020, the firearm homicide rate increased nearly 35%, reaching its highest level since 1994, and the majority of homicides, 79%, and suicides, 53%, in the US in 2020 involved a firearm. It is important and interesting both because yet another public health frontier of threat and concern to well-being, and yet another front of deeply politicized conversations around cause and effect, and yet another challenge to what you've already said, and my word, not yours, is a bit of a rickety public health system. So that is a stress test. And how do we, when we're so deeply divided and the system is flawed, how do we come together around the public health dimensions of a challenge like firearms, especially in a moment like today?
Yeah, so maybe just a few other statistics if we're not alarmed enough. In the last 3 years, ED visits, emergency department visits related to firearms, have gone up every year by another 20 to 30%. And I don't think we can sort of address this issue without talking about the tragedy of just this last week. And that was on the news because there were 6. And as you mentioned, the firearms and suicides, those are the one-offs. The one you hear about on the news, those are, you hear about them because they're more people, because they're tragic in schools, but the homicide and suicides are extraordinary in terms of numbers. You know, what I generally try and do, and I have the gift and opportunity to meet with members of Congress on both sides of the aisle, is to sort of talk about where we agree. Can we agree that we don't want our loved ones dying at the hands of firearms? If we can agree on that, then what are the things that we can do to protect? Can we talk about safe storage? Can we talk about research in, and I went to a firing range, a 4-H firing range in Vermont, where they had 8-year-olds learning to shoot. And so one of the questions is, how old is too young to start talking about what a firearm can do? Do we even have research on that? When do you start talking about those things? So let's sort of agree that we don't want our society and our children harmed by these. Let's agree on that. I think we can agree on that. What are the things that we can do together? I don't necessarily want to infringe on your right to own. What can we do together to make it safe?
I think I was 8 or 9 when I learned to shoot a firearm. So it was really interesting to hear you say that, because I think we don't think of that in ourselves. You know what I mean? So that's striking, because I think also culturally, right, we have a set of questions that I think have come up, and I'm curious to ask you about this, across a collective public health in an individualist society with serious regional differences. And I wonder what the potential of public health is, actually, a shared understanding of our need for public health, the interdependence of public health, to create some sense of bond or community if we do it right.
Yeah, I think it's gonna, I mean, in firearms specifically or sort of in general.
Even in general.
Yeah, I mean, there is so much that our public health infrastructure in this country needs. And when I think about infrastructure, when we talk about workforce, when we talk about data needs, when we talk about laboratory needs, there was, ahead of the pandemic, there was a survey that said that we in this country are about 60,000 public health workers short. And so when you think about, and many people have retired during this pandemic. I couldn't tell you the stats right off the top of my head, but many people in public health have resigned and retired and been driven out. So we have a workforce that is frail that we need to bolster. When I talk to members again, and they say, well, you know, I want to have more wastewater surveillance and more genomic sampling, I might say, do you have a genomic epidemiologist in your district? Because that's the infrastructure that we need. Data, I'm data driven in sort of my day-to-day life. And the data systems in this country, the public health data systems in this country are appalling. It truly is. CDC gets data from 64 state jurisdictions and territories.
That's more than we have states.
Well, we have big states, big cities, and then our territories. We get data from 3,000 jurisdictions, and we get data from 574 tribes. And all of them report in a different way. Yes, some through the pandemic reported by fax, some reported by email, some reported by cloud, and some by Excel spreadsheet. That's our data system in this country. And I will say, in the absence of a pandemic, all of it, for the most part, except for nationally reportable diseases, report voluntarily. So we at CDC do not actually have the authority to require data come in. That is not a data system that is nimble enough to be able to rapidly detect a challenge when we have it.
So it almost feels silly to say after that, hey, let's talk about readiness.
We are, yes, please, I would love to.
All right, okay, well then let me begin with a very open-ended question. Talk a little bit about readiness.
So we need a workforce that's ready to respond, and that is true at CDC, 12,500 people strong. That is true at public health across the country, it's state and local public health, and it is true at public health around the world. One of the things that we are doing at CDC, recognizing, and I do like to remind people, the last pandemic was 105 years ago, and CDC is only 76 years old. So we have never had to do a pandemic like this before. But one of the things that we really learned is that everybody at CDC has a role to play in the pandemic, can be deployed to a response. We have had ongoing responses at CDC since I got there and long before, whether it be the polio response or the Ebola response. We're now in a Marburg response, and the COVID response, and an Mpox response. There have been numerous responses. But at the height of COVID, we had 2,500 people at a time deployed in the response. So when you think about an agency that's 12,000 big and 2,500 people at any given time needed in a response, either to go work on a nursing home outbreak in wherever it was, or a seafood plan outbreak, or a vaccine task force, or whatever it is, we need a workforce that's ready to respond. So that's a lot of the work we're doing. I'm really proud to say I just returned from Vietnam and Thailand, and we at CDC have country offices in 60 countries around the globe, and much of what we do is field epidemiology and laboratory training programs where we are on the ground. We have over 1,000 people on the ground around the world training the next generation so that we can scale up public health around the world.
What does that look like? It's hard. I think without seeing that, it's hard to understand what that is. When you're training, who's there? What are they training people on? What does that look like?
I met a young gentleman in Uganda at the Uganda-Congo border, and they were at that border site in our global health security. They were training on what does it look like when somebody with active Ebola comes into this country? And what is it that you are supposed to do? And that gentleman had detected a case, had texted on WhatsApp, and it was a mom and baby who had fled the Congo, and probably prevented a lot of deaths in that hospital because he knew what to look for. He detected, he isolated the patient, and the patient was positive. So that's, I mean, there is a lot of how does one do a laboratory test? How does one do a PCR test? We have a lot of work through the President's Emergency Plan for AIDS Relief around the world in HIV. And so many of those laboratory workers that we had trained in HIV PCR pivoted immediately during the pandemic and were able to do COVID PCRs. And so all of a sudden our lab work could be leveraged for another infectious disease threat.
So I'm going to say a word that will immediately cause half the room to fall asleep, and that is procurement. But I have such vivid memories. One of the random things at WBUR, I was in the station one day early on, and somebody said, you know, we need you to cover the governor's press conference today. Which I had never done before, but after one day, you know what you're doing. And I wound up just covering days and days and days and days and days of daily press conferences, where the frustration over and over and over again was basic, you remember, PPE, right?
I remember it well.
And so I remember having a conversation sometime in the last 18 months with Dr. Ashish Jha, who of course now is in the Biden administration, talking about what lessons we could have and perhaps have not sufficiently learned in terms of procurement of the supplies and the materials and the scaling up rapidly when we need to of drugs and medications, et cetera. Have we learned the lessons well enough from this one, especially when it comes to things like, you know, it's not sexy, but procurement?
Yeah, so there's a lot of work that's happening on that. Much of that work now, this is probably more in the weeds than you care to talk about, but the Strategic National Stockpile has moved to the Assistant Secretary of Preparedness and Response, and a lot of that work on the SNS, the Strategic National Stockpile, lies with her, Dawn O'Connell, a dear colleague. It is not, there are two challenges here. What are the lessons that we learned, and do we have the resources to actually address those lessons? And that is true at the SNS, and that is true at the CDC. You know, and it's not, I mean, as not sexy as face masks and PPE are, neither is like tube feeds, and neither are, you know, pediatric endotracheal tubes. But those were some of the things that we were hearing about. So we are working towards that. There are a lot of lessons learned at ASPR. There have been a lot of lessons learned at CDC. Whether we will be granted the adequate resources to take those lessons, solidify them, and be able to do everything that we need to moving forward is still unclear.
Do you want me to go to Q&A? All right. So I have a list of questions that came from audience members in advance, and I'm going to kind of pepper through them, and we'll spend another 15 minutes or so in that space. What has changed most for you? And this says besides your job, because of the pandemic.
I would probably put that into 3 different buckets. I think all of us have changed personally. Like, none of us can take the kind of person we were at the end of 2019, fast forward to where we are in 2023, and sort of say, do I wear a mask? Do I not wear a mask? How crowded is it going to be? Like, there's just a lot of internal stuff. My family's changed, and like my family grew and developed and fostered, and you know, thrived and didn't thrive during the pandemic. So there is a lot of that. Personally, I will say, being in this position has turned my life upside down. And so that, you know, in Atlanta most of the time when I'm not in DC and when I'm not in Vietnam and Thailand. I'm traveling the country and visiting departments of public health. I'm doing a job that I didn't envision that I would be doing. I have protesters outside my house. I have security issues. So, you know, I am not the same person I was 3 years ago.
Is it worth it?
There is, you know, one of the things that I really, when I soul searched about whether I should take on this job, part of the counsel and wisdom that was given to me was, and that I truly felt, is if somebody is calling you in this moment of crisis, then you stand up and you deliver. I said in my nomination speech, when your code beeper as a clinician goes off, you run to the code. And this was my code call. And somebody thought the country needed my help and that I was going to be able to help. So I said yes. There was something that was nice about being naive enough that I could do that. I still believe in that answering the code. So had I known all that I know now, I still would have answered it. But I would have been perhaps a little wiser, a little more eyes open.
I want to thank you for being honest in your answer to that, because I think it's important for us to understand that the burdens that our public leaders accept on our behalves.
Maybe I will just say that, you know, when I started, I said, these are going to be all the things that are going to be hard. I'm going to be spending most of my time in Atlanta. I'm going to be on the road a lot. I'm going to be traveling a lot. And all of those became the easy things. And it turned out that there were like this whole layer of things. And among them truly is my lack of connectivity to my parents, and I'm connected, but like I don't have a lot of flexibility in my world. I don't have a lot of downtime. Any given dinner that I want to have with a friend generally gets canceled for something that is beyond my control. So those kinds of things, I miss those.
You want a glass of wine? No. We can bring one right up. Somebody's got one that's undrunk, right? So interestingly, number of questions from audience members about your self-care. So I will pick one that's just an example. Where do you find joy and peace while navigating such great responsibility?
I do like to work out.
What do you like to do? You like
elliptical,
cardio or weights?
Elliptical bar method. You know, I try and work out with a friend. Because it's just like some social time. I really do adore my husband and family. And so any given time, I will try and FaceTime my kids. I will try and, you know, I love watching a movie with my husband. Like, I love to laugh. So any place that I can find joy and humor and fun with a friend over coffee, that, I mean, it's like really small stuff. It actually doesn't take a lot to fill my tank.
Do you want people to text you jokes?
Yes, I do, and memes.
All right,
memes.
Everyone that has her cell number, with some moderation, you now have an assignment.
I'm gonna have a whole slew
to text jokes. So I asked this one 4 years ago, where did you think you'd be today? So let me ask you this. Do you have the bandwidth to think about 4 years from now where you think you'd like to be?
I generally, if anybody who knows me, I generally like control. I like to be in control. I like to know what the next step is. And for my entire career, for the most part, I sort of saw what that next step was. I don't know what that next step looks like for me, and I don't know when it'll be. But what I do know is I'll probably take some time to heal.
Yeah. Which of the, we're going to go back to serious, not that that wasn't, but which of the many public health concerns we currently face is of greatest concern to you, and what do you think is needed to address it successfully?
I will probably lump that into two big buckets. The public health infrastructure has to be one of them because it is so frail and because we don't know what the threat of tomorrow will be. And so we do need a nimble infrastructure that can detect a threat when it comes, that has a lab that will be able to do the laboratory, that has a data system that can sort of connect, and a workforce ready to respond. We did not see, it's not that we weren't ready for MPOX, it's just we just didn't think that that was going to be the next thing. And so given that we don't know what that next thing is, we do need that infrastructure, a really robust infrastructure, and we are working on it. We have a whole data modernization initiative at CDC. We received $500 million in CARES resources, and in fiscal year 23, we received $150 million, and everybody says that sounds like a whole lot, and I have one county's health department who says they could use it all. And single hospital systems have cost $1 billion to put in Epic. So it is not enough for the country. So the health infrastructure, the public health infrastructure is really something we have to work on. And if we are able to do that, then we will be better prepared for anything. The other big thing that is really a challenge in this moment is vaccine confidence. And it is not just COVID vaccine confidence, it is vaccine confidence around the country.
Why are we losing vaccine confidence?
There were people who were trying to undermine vaccine confidence before COVID-19 vaccines. And it really just took off in COVID. Social media didn't help. The politicization of public health and of vaccines and vaccine mandates, all of that didn't help. In the last 2 years, every year we have seen a 1% decrease of full vaccination for incoming kindergartners around the country. That is 250,000 children who are not up to date on their routine vaccines. We saw a paralytic polio case in this kind, I know that's the third time I'm mentioning it, but it is astounding that we had a paralytic polio case in this country. And I do think many people, there was just a tweet of a parent that said, I'm scared my child was just exposed to measles and they're not vaccinated. What should I do? And it's almost funny, but it is so not funny. So that, I think, vaccination is one of the, for any one of the vaccine preventable diseases, one of the best things that we can do in public health. And yet we're a victim of our own successes because people haven't seen what happens. I talked to, my parents, my in-laws, what happened when polio vaccine was rolled out? Everybody ran to get it. People were taken out of sleepaway camps so that they could go get their polio vaccine. That is not what we're seeing now. So I do think that really threatens public health in this country.
Okay, let's do two more. One fun from me, and then one bigger one from the audience. All right,
Okay.
A little fun one from me. What song is your jam right now?
I like Journey.
All right. Okay, that is so much better an answer than I was expecting.
There are so many, but
That's fantastic. Okay, last question, and I'll ask the audience question, and then I'm going to sharpen it a little bit, okay? So please share your thoughts and concerns regarding mental health in the U.S. post-pandemic. We've touched on that some. So let me end with this. In your mind, what is the call to action for our women and girls when it comes to mental health?
I'm going to get a sort of a big picture answer, and part of this is because our work at CDC and mental health, we collaborate across the U.S. government with SAMHSA, with HRSA on resources towards mental health. But prevention has to be a big part of it. I think the statistic of 13% capacity for treatment means that we have to go way upstream of that and get to prevention. We do a lot of work at CDC on adverse childhood experiences and ACEs. I don't know if people are familiar with that acronym. ACEs are things like suicide in the home, or sexual violence or intimate partner violence, or a firearm, or food insecurity, or emotional abuse, really severe things that affect youth that they have. It is true that the more ACEs that one has, the more likely that they are to have any given bad public health outcome. More likely they are to smoke, more likely they are to have mental health. If you have 4 or more ACEs, you are 25 times more likely to have a suicide attempt. So the work that we have
You just need to say those numbers again.
If you have 4 or more ACEs, adverse childhood experiences, food insecurity, drug use in the home, whatever that may be, you are 25 times more likely to have a suicide attempt. And that means that the work that we have to do is to prevent those adverse childhood experiences. So that means economic stability in a home. That means teaching children and social supports as to what is a healthy relationship and what that looks like if they haven't had one. That is emotional support in schools. There's a whole host of things. We at CDC have programs in 6 states now, and we're working. I'm about to go defend our budget for '24, and one of the things that we really want to do is expand that from 6 states to many more states, so we can do a lot of that upstream work to prevent these adverse childhood experiences.
Please join me in thanking Dr. Rochelle Walensky. So while Dr. Walensky literally drops her mic, I will just finish it from here. Thank you so much for being part of tonight. Women at the Center, the kickoff centering women's and girls' mental health. I'm proud to be a part of this community. And on behalf of the Brookline Center, thank you for coming. Good night.